Good morning, everybody. Dr. Niranjana is the chief author. I'm Dr. Shweta. I'll be the presenting author for our paper, which is Argos versus IOL Master 700, a comparison. So, as was mentioned previously, accurate measurements of ocular biometry are of prime importance in IOL power calculations. So, the measurements are usually axial length, keratometry, anterior chamber depth, corneal diameter, and lens thickness. So, as we all know, biometry can be ultrasonographic or optical. So, under optical, in the subcategory of SSOCT based, we have IOL Master 700, which uses a single refractive index, and a relatively newer biometer, Argos, which uses a segmental refractive index. So the objective of our study was to determine the agreement between the measurements made by IOL Master 700 and Argos. There are no financial disclosures. So we conducted a hospital-based retrospective comparative study over a duration of 6 months, including 30 eyes. The inclusion criteria were patients who underwent biometry for cataract surgery with no prior ocular surgery, ocular trauma, or pre-existing ocular diseases. So in our demographic analysis, we found that majority of our patients were female and the average age was 60.53 years. With respect to the axial length, we found that both machines gave good correlation between their readings, and the mean difference between the two was not significant, and the limits of agreement at 5% and 95% confidence intervals were found to be acceptable. We had similar findings with respect to the keratometry, where they correlated well when there was no significant difference between the two, and as well as the lens thickness. However, when we come to the anterior chamber depth, we found that they did correlate well, but the mean paired difference of 0.122 mm was statistically significant. And the limits of agreement at 5% were 0.07 and at 95% were 0.17. The white-to-white measurements, we found that they correlated well and there's no significant difference between the two. Coming to the IOL power, they did correlate well. However, there was a difference of 0.2 diopters, which was significant, but 0.2 diopters proved to be clinically insignificant. So this is just a summary of our results with the paired samples correlation, where we can see that all the values taken by the two did correlate well. And in the paired samples test, we can see that the anterior chamber depth is where we found a significant difference, and as well as in the IOL power calculation. So coming to our discussion, we found that in our study, the axial length correlated well. However, in a study by Yang CM et al., they found that in longer eyes, Argos gave a shorter reading, whereas in shorter eyes, Argos gave a slightly longer value. The K readings were similar in our study and in other studies that were done. With the white-to-white measurements, Yang CM did find a difference, where Argos measured a significantly longer white-to-white. The lens thickness as well, Yang CM found that there was a significant difference, but however, it was not clinically significant. With respect to the ACD measurements, similar observations as ours, where Argos gave a longer value, was made by Omoto MK et al. And with respect to the IOL power that we obtained, it was similar in prior studies. So the limitations of our study is that we did not subcategorize based on axial length, so we did not come to a conclusion whether it was different for different axial lengths. And of course, our sample size was smaller, which also serves as a limitation. So the conclusion we come to is that the most of the measurements taken by the two machines were in agreement. Further research with respect to the post-operative refractive outcome needs to be done. The difference in the ACD measurement and its implication on IOL power needs to be analyzed. And there is definitely a need to study the impact of using these two machines in different axial lengths. Thank you.
Good, Dr. Niranjana. I find that there's a difference of Argos and the IL 700. You said that the overall length measured by Argos is little less than what you measured in the IL 700, and especially the ACD is very, very significantly high in Argos. So, could you find out the reason why what is happening?
So one thing is Argos uses a segmental refractive index. So obviously in the anterior chamber, because it's measured through the aqueous, it uses a different refractive index versus what is used for the vitreous, whereas IOL Master 700 just uses one refractive index value to measure. So it
But
could
then
be because of
ultimately
that.
the result of
Yes, the
AL or
IOL
power
power-
calculation should have been the
yes.
same, but there is difference.
IOL power was not clinically significant, the difference in the IOL power. So ultimately, there may not be a clinical significance, but because our sample size is small, that serves as a as a disadvantage to come to any proper conclusion about
So
it.
this serves more as a pilot study. Sort
Yes,
of.
yes, ma'am.
Thank you.
Yeah, I agree. I think your sample size is too small to really come to any conclusion. Until the time you don't have eyes which have like smaller eyes or longer
Yes,
eyes,
ma'am.
you will not be able to come to a conclusion.
Yes, ma'am. We are planning to do more in that aspect.
The refractive outcomes also
Yes,
has
ma'am.
not
Yes,
been
definitely. Thank you.